Hi, everybody. Great to be here. I'll start by thanking the Sea Heat and asthma teams who have done a lot of the work that I'll present. Everything I do is interdisciplinary and has great collaborators. So next slide, the first project I'll share is a community engaged research study of extreme heat that I co-direct with Madeline Scamo, who's a professor in our department as well. It's a partnership with Green Roots, which is an environmental justice organization. And we've done a mix of activities. They're sort of pictured here on the slide. So it includes, for example, building maps of heat vulnerability. That's across different sociodemographic, housing, lots of different dimensions. And then also building maps of assets such as green space and other things. We've also, if you look at the photos in the top corner, we've monitored temperature inside homes and all over the city outdoors. And then paired that with biometric measurements, so things like heart rate and physical activity, trying to understand what the changes are during extreme heat. It's been a really great researcher community city partnership between Green Roots, City of Chelsea, to a lesser extent, the City of East Boston. And some of the activities that we've been able to do sort of in parallel with the research is identifying heat islands, identifying vulnerable neighborhoods, and built environment infrastructure. That's sort of as part of the project. Our collaboration with the city has also informed investments in things like white roofs, green space, and pervious surfaces. So thinking about where there would be the most impact if you were to paint roofs white across the city, and making sure that that's happening in vulnerable neighborhoods. And then supporting community resilience, supporting a lot of the Green Roots initiatives, such as park design, engagement and education, research translation, so making all the data really in English and in Spanish, but sort of easy to use, and then providing data for grants and reports and hopefully policies. Our next steps with this work is to actually investigate whether all of these interventions actually impact health of residents, and then thinking about housing and other policies that could reduce extreme heat exposure. Next slide. The second area of research is really different. It's about climate mitigation interventions in housings and buildings, and it's a systems science modeling project. So systems science is a tool we use to understand very complex systems when it's hard to actually collect the data in the field or to engage a community. It's sort of lots of moving pieces. So this framework that's here in the middle is basically a model where we can simulate children who live in different types of homes. We can estimate what their indoor air exposures might be. So things like PM 2.5 or combustion products from stove use, for example. And then what that impact is on lung function. And then, for example, asthma exacerbations over a long period of time. So we're using that framework, which was really about asthma and housing, to look at the impact of different activities. And this is work that Kate Connolly, a doctoral student in my group, is doing. And she's quantifying the trade-offs on sort of energy use for heating and cooling, indoor comfort, indoor air quality, asthma exacerbations, and healthcare utilization. Again, lots of sort of moving pieces. But the example to give of the project she's working on is as Boston moves into their climate action plan and decarbonizing the residential sector, we're investigating what happens. So what will happen with changing climate if the housing stock doesn't change? What happens with changing climate if the housing stock does change? And then what happens in multifamily homes, which represent a large fraction of housing in Boston, and is also important because it's been less studied and is typically home to more vulnerable populations. So this is a fun framework that we're sort of now moving into the climate area. And with that, I'll turn it over to Lucy.